So first of all, my name's Isla Horton. I'm the director of Grow Cardiff. We are a registered charity that supports community gardening across Cardiff and beyond. Over to you, Claire.
So I'm the Grow Well project officer. I deliver the gardening sessions, and I'm an occupational therapist by profession.
Hello, I'm Karen Pardee. I'm a GP and I'm also the lead for the Cardiff Southwest cluster.
So I always think sometimes, even after really interesting presentations from Sienna and Joanne, after an hour of Zooming or Teams, it's just nice to have a little pause. So with that in mind, for something completely different for 30 seconds, I invite you to imagine that you're sitting in the garden, a beautiful garden, and just to take these words in as we introduce our project. When your burden feels heavy, step outside and set outside your burden. Set down your burden. Rest a while with the sun on your face and breathe deeply. Let your hands loosen and listen to nature's words. From seeds of sadness can spring new beginnings. Claire, our project officer who introduced herself, wrote those words this week as a reflection of patients coming to the project who were experiencing bereavement and or had anniversaries of bereavement. Sometimes the things that come up in the garden are very pertinent, very emotional. And I wanted to say from the beginning really that our project, the Grow Well project, which we'll introduce, is not for gardeners, it's not for people who want to garden. Rather, we use gardening as a tool which enables health and well-being in our patients. So to go on to the next slide, please, Hannah, thank you. Our Bevan Exemplar project is called Grow Well. Grow Well is an active partnership between Grow Cardiff, the organisation which I head up, the Cardiff Southwest Primary Care Cluster, which Karen heads up, and patients from local surgeries within the cluster. We're very proud to be just one of a handful of voluntary sector-led organisations in this year's Bevan Exemplar cohort. The partnership came about from the seed of an idea, forgive me, by the wonderful Dr. Pardee here in a telephone conversation in 2016. Her GP surgery had some land. There could be potential benefits for patient health and well-being to create a garden on the surgery site, and could we meet and discuss further? From this seedling project idea, the Grow Well project has grown and flourished with hundreds of patients, just over 300, taking part over the last few years, particularly with those living with mental and physical health difficulties, experiencing loneliness and isolation. And together we design, create and develop therapeutic community gardens at 2 sites in the cluster. Our weekly therapeutic community garden sessions provide a safe space to develop new skills, sowing, nurturing, harvesting fruit and vegetables, cooking produce, as well as engaging with nature, building, carpentry, arts and crafts, and most importantly, finding a place to belong and build friendship. However, until the Bevan Exemplar opportunity had come along, the partnership had not been able to provide a service to those patients in the most easterly reach of the cluster, those living in inner city Riverside. And so our Bevan project really focused on the development of a new Grow Well project in Riverside, and Karen's going to now talk through the aims of the project.
Thank you. So as Isla has just said, this is very much an extension of the work we're already doing across Cardiff Southwest cluster, but we very much wanted to develop a therapeutic community garden for our patients living in the Riverside area. The GPs and the patients in that area have been asking for it for some time, and it's something that we very much wanted to extend to that area, with particular needs of being an inner city area of Cardiff with a large BAME population, and we wanted to set it up in the grounds of the Riverside Health Centre, which is home to 2 of the GP practices in our cluster. We wanted to improve the referral pathway as well. To date, it's been fairly ad hoc. There's bits of paper flying around, and also, sometimes people self-refer or there's word of mouth, but we really wanted to improve that, particularly looking at a digital solution. And also, we very much wanted to improve the evaluation of the project. I mean, we see it every day, the value that this brings to our patients, and I've seen what a difference it's made to my patients' lives. But we wanted to really put in some robust evaluation around that, particularly focusing on those patients living in the Riverside area and working with academic partners to do some quantitative and qualitative methodology around that, as well as co-producing evaluation tools with our patients.
So the plan was that we would begin to work with patients living in Riverside area, and you can see in January and February we started that. Obviously these photos were taken pre-COVID. We started running on-street sessions around Riverside and around the health centre with local patients, and you can see some patients here, they're planting lavender and sage, the idea being that people could enjoy planting and then come along and harvest them as they wanted to. And we called these walk, talk and plants with large planters such as this that are dotted around Riverside, while we worked with the health board to begin to work on the Riverside Health Centre site. That was the plan. That was plan A. And then of course March came and COVID hit hard, and we had to think about plan B. All our community gardens and group sessions had to close when COVID came and the lockdown arrived. On the brink of furloughing staff for months, we had a thought. Would people like to grow at home instead of growing in community gardens? We'd never done this before because our mantra, our DNA, is to grow in group and together in community, but obviously we couldn't do this. So we posted a simple offer on social media and put it out through our networks. Would anybody like an everything you need to grow at home kit? So you didn't need to go out to do the growing, thinking that a handful of people may be interested. And you can see the little kit there in the photo on the top left-hand corner. In just over 24 hours, over 250 households got in touch with us. And they told us things like, growing plants and tending to my garden is massively going to help me with my mental health during this time. I suffer with anxiety, so being able to focus on a project is really amazing. Thank you. It's great to focus on something. My daughter, who's 3, loves gardening. My husband has mental health issues and has been doing lots of gardening at the moment. Somebody else, my 8-year-old is shielding. We've just moved to the area after a sudden family death. Thank you. I'd really like to take part in this project. Another participant, I work for the NHS, and on days off, we've luckily been spending time in the garden. I've been growing the radishes you sent me, and it's really motivated me to try to grow other things. I'm really learning. Thank you. Realising that if we continue to support people to grow at home, we could make a real difference to their health and well-being, we developed the project further. We supported 650 children to grow in 17 hub schools across Cardiff, and we refined our home growing response in the cluster. In the last photo, you could see Claire there with her home growing kit. So we dropped 100 grow bags with tomatoes and courgettes to patients living in the cluster, taking them to their doorstep. And we supported that with online instructions, YouTube videos, and groups to help people to engage and connect with each other through growing during the lockdown. We began to hear about other organisations who were also helping people to grow, and there's really been a key learning to partner with people. So in Plan B continued here, you can see we partnered with South Riverside Community Development Centre in Riverside. We ran together vegetable giveaways during the lockdown, which were COVID considered, and people self distancing from one another, social distancing and so on. And we gave out thousands of plants to people. Around 256 households took part in these vegetable giveaways. And you can see the lady here on the right taking chilies to grow at home. Again, people connected with each other through growing. And many of these people obviously are patients in Riverside, and particularly with the Riverside Health Centre, that we were keen to engage in the original aims of the project. Since lockdown has ended in September, we've been able to reopen and restart our walk, talk and plant sessions, which are COVID considered, out and about, and we're continuing to work with the health board to be able to develop our Riverside Health Centre garden on site. Claire's now going to discuss some of the other key outcomes from the project.
Okay, so looking back at what our key aims were at the beginning of our project, at the Riverside area, despite being unable to deliver the Plan A, all of the engagement work which we carried out through lockdown has given us connections to the people who want to engage in the Riverside Health Centre garden development. We are part of a 100-strong WhatsApp group of local Riverside patients who want to grow food, who are connecting with each other, sharing ideas, sharing knowledge and skills with each other. Since the lockdown is lifted and we've been able to work face-to-face in Riverside again, we began engaging again with local patients, and we've currently got about 20 patients who are referred and accessing the project through our walk talk plant sessions and through a home growing project called Growing Companions, which is aimed at the people who still are quite isolated and feel the need to stay at home. Some of our patients struggle as a lot of services have switched over to Zoom or on the phone over COVID period, and having an outdoor safe space can be an absolute lifeline. And as Isla showed you the slide at the beginning, in one session this week, we had a gentle conversation with how to cope about recent and not so recent bereavement from a man whose father died when he was still a child to another man whose partner committed suicide. So the issues that people can bring to the garden are very raw and very present still in their mind, and we're here to be able to listen to them when they need to talk. In terms of our referral pathway, Grow Cardiff has worked with the 10 GP surgeries and our other regular referrers to create a systematic social prescribing system and a referral pathway. And a key part of this has been the social prescribing online platform called Elemental, which allows different agencies to refer and share information in a real-time, seamless manner. Our staff are now trained, the system's up and running, and we're able to accept referrals there. Grow Cardiff is now one of 6 organisations in the social prescribing pathway, and it's great to be on the inside of that system rather than being on the outside looking in. This has significantly increased our number of referrals to the project, such that we are at capacity at some venues and considering increasing the number of sessions we offer during the week. In terms of our evaluation aims, pre-Bevan, we had taken the evaluation as far as we could with our existing knowledge. We realised that we needed more expertise, so we have now partnered with the University of South Wales, Professor Carolyn Wallace, and we're working with her team and vitally with patients on the project to research how the Grow Well project impacts health and well-being and how to develop a new tool which can help us measure these outcomes. So I think Karen is going to talk about the next steps.
Thank you, Claire. Yes, so moving forwards, obviously the partnership between Grow Cardiff and the Cardiff Southwest Cluster continues, and we're really excited to be part of that. What we really want to do is reframe our GP practices and surgeries as places of wellness and well-being, and not just places that you go to when you're feeling sick or unwell. And we've really seen the benefit of having these gardens based on the GP practice sites. And that's not only for the patients coming in, but also for the staff and visitors who really value that environment. We're working together with partners to improve the social prescribing system, as Claire has mentioned, using a digital platform. And within that system, we're very much working with our patients who are our volunteers within the gardens. And it's also really important to hear their voice about how we develop our social prescribing system. And so in both the developing the system and also in the evaluation tool, we're very much listening to patients, finding out what matters to them in terms of health and well-being, and make sure that we are measuring what matters to people, collecting their stories for qualitative data and empowering them to share their experiences. We're also very much sharing our learning with others in this sort of setting, and others sharing what we're doing. And we've had a lot of interest from across the UK in what we're doing here in Cardiff, and looking to support other people to do similar things within their own communities.
Moving on to our Bevan experience to finish off. Being part of this project has been exciting, stimulating and a wonderful learning curve. And we really want to appreciate and say thank you to the Bevan Commission, to Helen Howson, to Sean, to Nick Rich and Hannah Thompson, who've been sterling support to us really throughout the process. We've also met really other inspirational colleagues, and not being part of the health system, actually as a voluntary sector organisation, it's been fascinating and a wonderful place of learning. Reflecting on being part of this process, I think a key message for us has been when we hit barriers and unexpected events, to put it mildly, happen, to feel the fear and to do it anyway. We decided to change our DNA to help people to grow from home and to reach out to people in new ways, something we'd never tried before that was completely out of the box. And even though we weren't sure where that change would lead. So our first learning is really to dare to sow new seeds and grow in strange new ways in terms of our practice. Sometimes the change that you bring resonates with others. We had no idea that 250 people would request a C kit, and we hadn't thought about the postage for that, which was actually quite expensive, with each kit costing between £1 to £3 to deliver, depending on whether people had multiple children or so on. And a colleague of mine saw the post that we put out and from an old project, and he turned up on my driveway, at the end of my driveway, with his stamp collection from about 2 or 3 decades, which was worth about £500, and we used that to post out all the kits. So they had stamps of Princess Diana and things like that, and it just showed that actually what we were trying to do, other people understood it and it really resonated with them. But that's not always the case. Our framing and understanding of the benefits of a project can be very different from other organisations. Coming from the third sector, we are learning to translate the aims, methods and outcomes of our work into quantitative and qualitative results that health professionals and management value and recognise as shared goals within the primary care and healthcare sector. Despite full support from the cluster, from Karen and colleagues, we still need to overcome barriers with the Health Board to begin to work on our Riverside Health Centre land and to develop the garden there. While we're working with colleagues in the Health Board to do that, it doesn't mean that our work has to stop. Being a small organisation with staff who are prepared to be creative and do something different, even when they don't know the outcomes, is risky but exciting and can have real potential. We continue to engage with patients in Riverside as we, through our on-street gardening sessions and through the Growing Companions project that Claire described, delivering growing kits to people who are choosing to self-isolate at home out of health concerns. One of our really important lessons has been that partnerships are absolutely key and that partnership development must be intentional. The Growing Together network initiative that we were part of during the lockdown was a fantastic example of this, and it came out of the lockdown experience. We were familiar with all of those projects, including South Riverside and many others who took part, but we weren't actively working together. And through the project, we were part of being a network that gave out over 15,000 vegetable plants to people through the lockdown. Real change comes through actively building partnership. We've learned that the social prescribing system itself requires leadership, resources and time to make it work well. It requires intentional shaping and development. Referring a patient to a project is not a social prescribing system. A well-run system doesn't happen unless all the partners, including the patients, are equal in the process and work together to create the system they need. Finally, we have had much positive feedback, press coverage and endorsements for the project, but funding the work continues to be insecure. We have around 6 months funding left. Change, even good change, takes time and requires consistent thought and attention to be sustained. And only then will the seeds we have grown grow into something that may one day become mighty oaks. Thank you very much for listening, and thank you very much to the Bevan Commission.